One of Western New York's largest healthcare system is anticipating the effects of the healthcare cuts from the federal One Big Beautiful Bill Act. Kaleida Health has confirmed that it will no longer be able to operate its two Buffalo Therapy Services clinics located in Amherst and at DeGraff Medical Park in North Tonawanda. Now, the news hitting hard for various Western New Yorkers who utilize these clinics for much needed treatment. And I spoke with one man out of Hamburg who shares the type of blow that this brings. Both Buffalo Therapy Services, located on Maple Road in Amherst and at DeGraff Medical Park in North Tonawanda, will be closing in about 90 days. Kaleida Health states that this is the result of spending cuts at the federal level. Health providers across the country are exploring cost-cutting measures to mitigate a decrease in Medicaid spending over the next decade. Several Western New Yorkers I spoke with today shared their disappointment on the announcement.
I was in a car accident the day before Thanksgiving in 2017. And in 2018, I was still experiencing a lot of symptoms from severe concussion.
Phil Stokes is a Hamburg resident who received treatment for 6 months at the Maple Road location after suffering a traumatic brain injury. He says that he worked with a cognitive therapist to help him improve his memory and speech back to the level that it was before the crash.
Working with their staff, it was, they were very patient, they were compassionate, and they were, very good at keeping me on track. Challenging me to, push myself to continue to improve.
He says this move is disheartening because of how it will impact patients on Medicaid.
I think about my parents, and I think about how, now it's going to be more difficult for people to find a provider, right? It's going to take longer for someone to get an appointment when they are initially diagnosed with some issue.
The cuts is a decision that the healthcare system says is being forced to do, saying in part, the decision was based on several criteria, including reductions in funding and reimbursement, financial viability and sustainability of these locations and services lines, as well as access to these services in the community. This unfortunate shift in the healthcare economic landscape does not diminish these teams' skills or commitment to our patients in our community. Now, both clinics are scheduled to close on November 10th. Not only will patients be impacted, but so will about 30 employees.